Alicia. So today I'm going to go ahead and perform an NG tube placement for a competency video. So first and foremost, I'm going to go ahead and check the computer, just making sure to verify the process to see the doctor's order for the NG tube placement. I'm checking the computer. I'm seeing that an NG tube placement needs to be placed because the patient hasn't really been eating and it has had difficulty getting his meds. So I'm going to go ahead and enter the room. I'm going to perform hand hygiene. Okay. And I'll go ahead and perform some privacy and introduce myself. Hi sir, my name is Alicia. I'm your nurse today. I'm going to go ahead and place an NG tube placement. It seems that I checked your chart. It doesn't seem like you're eating very well and you're having difficulty getting your meds. So the doctor wants to place this so it's easier for you, okay? It's gonna be a fairly quick procedure. It shouldn't hurt. It is a little bit uncomfortable, but we've done this plenty of times, so we'll make it as fast as possible, okay? Okay, so then I'm gonna go ahead and verify my patient with name and date of birth. So Mr. Smith, March 6, 1966. Okay, so I'm gonna go ahead and raise my bed to a comfortable working position. Okay. We're gonna go to about like a high Fowler's, which is about like 90 degrees. Here is good. Go ahead and go down. Call light out of reach. Gonna go ahead and drape my patient. So I'll put this drape over him. Okay, and then go ahead and lift your head for me, sir. Okay, and so I'm gonna go ahead and further explain the procedure to the patient. So when we insert the tube, I'm gonna let you know when to tilt your head back. And then there is going to be a point where I'm going to tell you to tilt your head from chin to chest forward. And I also have a glass of water here, and I'm going to instruct you when to take a sip every single time I advance the tube. But I'll let you know when that happens, okay? So I'm going to go ahead and also give you this bin here. This isn't mandatory. It's just in case you need it. And then at this time, I'll go ahead and assess his nares too. Just to kind of see the patency of it. Okay, so I'm looking into his nares. And then I see that there's kind of the left one is a little bit deviated. So I'll go ahead and pick the right nair here. Okay. Okay, so then at this time, I'll go ahead and measure my tube. Let me go grab it. Okay. So at this time, I'll go ahead and pick the appropriate tube too. So I see here that the nostrils are fair size, so we'll pick a 12 French. And I'm just gonna assess the tube really quick to make sure there's no any like cracks, leaks, anything like that. I'm gonna measure the tube now. So I'm gonna measure from the nostril, and then I'm gonna go ahead and go to the ear. Okay, and then I'm gonna go ahead and just really quickly, I'm just gonna put this down, okay? Okay, so nose, ear, and then I'm also gonna go to the tip of the xiphoid process. Okay, so it looks like the measurement's gonna be at about 50. Alrighty. Okay. So I'm gonna go ahead and mark my tube at 50. Okay, so then at this time, I'll go ahead and lube my tube about like 2 to 4 inches. And then I'll also spray some of this lubricant in his nair as well. Okay. Okay, so I lube it 2 to 4. Okay, so I'm gonna go ahead and start inserting the NG tube. So I'm gonna instruct Mr. Smith to tilt his head back. Okay, Mrs. Smith, this is the time to tilt your head back. So go ahead and do that. So head is tilted back. I'm gonna go ahead and insert. Okay, I'm gonna go ahead and start. So I'm gonna go ahead and advance the tube in an upward and downward position. Okay, if it's, let's say I meet, there's a coiling or anything like that, or I'm having difficulty, I would just take the tube out, or I would back the tube up, and then I would go ahead and redirect and then advance it again. Okay, so once I reach the pharynx, I'm gonna go ahead and have Mr. Smith tilt his head forward from chin to chest. Okay, Mr. Smith, go ahead and tilt your forward from chin to chest. And then I would go ahead and check as well, just making sure that everything looks good. If I notice any type of gagging in any way, I would go ahead and open the mouth and kind of just assess the back of the throat. Okay. So then I'm gonna go ahead and have your head go from chin to chest. Okay, and then I would go ahead too. This time I would give my patient that cup of water. Okay, and then go ahead and swallow for me. Okay, 1, 2, 3, swallow, 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 swallow. Okay, so it looks like this mannequin's not really letting me go forward, so I'm just gonna stop here. But in real life, I would go ahead and go to the 50 marker. Okay, so then now I would go ahead and secure my tube, making sure that I don't see any type of respiratory distress in my patient, making sure that we're not cyanotic. If my patient was cyanotic in any way, I'm gonna take this tube out. If I notice any type of gasping for air, I'm also gonna take this tube out. But right now my patient seems to be tolerating the tube well. So I'm gonna go ahead and secure it for now. So we're gonna go ahead and secure it with a stat lock. Okay, so then I would go ahead and at this time have x-ray come in to confirm the tube placement. So once x-ray has come in to confirm the tube placement, then I would go ahead and attach the tube to the gown. Okay, Mr. Smith, so I'm gonna go ahead and attach this to the gown. I would attach it with a piece of tape and a safety pin. Okay, all right, and then I will go ahead and attach now the suction now to suction, and I would have it be between 80 to 150. It looks like the doctor ordered it to be at around like 100, and it's going to be for intermittently. So it's going to go here, and it's going to be for intermittently. So then it's on intermittent there. And then at this time, I would go ahead and remove my gloves. I would go ahead and perform hand hygiene. I'll go ahead and put the call light in place. This hand here. And then I would put the rail up. I would put the patient back to a comfortable position. I would take the drape off and clean up my materials and just let the patient know if they need anything. Just go ahead and press this call light and we'll be in shortly, okay? And then I would document everything. So I would document the size of the tube. I would go ahead and document the time, the date, who placed it, the color of the secretions, which nair we're using. So we're using the right nair. It was a 12 French tube. It looks like the secretions are normal right now, which is great. Time and date, yeah, and that would be it. And then that would be the end of that skill right there. Okay, so now I'm gonna go ahead and film removing the NG tube. So I would go ahead and knock on the door. I would go ahead and perform hand hygiene again, provide privacy. Hi, Mr. Smith. I'm back. So I see that there's an order. Good news. I checked the chart too with the doctor that we can remove your NG tube today. It seems that you're eating really well and taking your meds. So I'm sure you're excited to take this tube out, okay? So let me just identify my patient again. Mr. Smith, March 6, 1966. I'm going to go ahead and drape you. So I'm going to go ahead and drape my patient. Okay, so then at this time, I'll go ahead and explain everything. So to explain everything, so I'm going to be taking the tube out. I'm going to switch off the suction. And then at my on my count, I'm going to tell you to take a deep breath and then hold it while I remove the tube, okay? So I'm going to switch my suction off. I'm going to go ahead and remove this here. And then at this time, I'm also going to be flushing my tube. It's going to be 30 to 50 mils of air or 10 mils of flush. So we'll go ahead and just do air. So we'll do 30 mils of air. And then we're going to go ahead and flush it. Okay. All right. Okay, so I have this towel here. This is just in case we need it. And then on my count, okay? Ready? Take a deep breath. 1, 2, 3. And I'm gonna go ahead and coil it, coil it, coil it. Okay. So this is good. This is ready to go down here. And then I'm gonna go ahead and assess his nares. So I'm gonna go ahead and assess it. Looks good there. Okay, so then at this time I would go ahead and check his respiratory status, making sure that we're not in any type of distress or anything like that. And then at this point I would go ahead and document everything too. And then I have the call light here, so I would remove this here. And then I would go ahead and give him some mouthwash. And then I would go ahead and give him some tissue just to wipe him up too. And then I would go ahead and document it. So I'm documenting basically the tube, if there's any like cracks or leaks in it. I would document the date and time. I would document the color, who removed it, how the patient tolerated it as well. And then I would put the call light here. So here's your call light. Here you go. And then I would go ahead and put the bed down. Put the pillow back too for him. That came off. Okay, I'll put the pillow back for him here. Okay, and then I would doff my gloves. I would perform hand hygiene, and that would be it. Skill complete.